Welcome to the Currents of Public Health webinar series, presented by the School of Public Health at Georgia State University. My name is Brian Greer, and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is expanding the reach of mindfulness for health promotion. Our guest is Dr. Claire Spears, who is an Associate Professor in Health Policy and Behavioral Sciences and directs the Mindful Living Lab in the School of Public Health. Dr. Spears earned her BS in Psychology and French at Furman University, her MA in Psychology at Wake Forest University, and her PhD in Clinical Psychology at Louisiana State University, followed by a postdoctoral fellowship at MD Anderson Cancer Center. Her research focuses on interventions to reduce health risk behaviors and enhance quality of life in underserved populations. She is particularly interested in mindfulness-based approaches and understanding the mechanisms through which these practices promote healthier behaviors. For example, smoking cessation, lower alcohol use, and healthier diet. Her work aims to promote health equity for underserved communities, expand the study of mindfulness to more diverse populations, and leverage mobile health technology, or mHealth, for scalable, just-in-time interventions. Dr. Spears' current research is funded by the National Cancer Institute, National Center for Complementary and Integrative Health, National Institute on Drug Abuse, National Institute of Mental Health, and the Fogarty International Center of the National Institutes of Health. She serves on the roster of experts on digital health for the World Health Organization and on the editorial board of the journal Mindfulness. Today's webinar will be guided by three general questions. What are you doing? Why is it important? And how can we get involved? A quick note, if you have a question at any point during our conversation, please feel free to type in the Q&A box and we will try our best to answer. And with that, let's begin. Dr. Spears, welcome to the webinar. Please tell us about your research and what you're doing and why is it so important.
All right, thank you so much for having me. So as I get started, I first just want to give a shout out to the GSU Mindful Living Lab. This is my lab at Georgia State. And this is just an amazing group of people, students and research staff, and really everything I'll talk about is thanks to them. So our work in the GSU Mindful Living Lab is really under the broad umbrella of health disparities and health equity research. These are the three main categories that we study, and I'll talk a bit about each of them. First is tobacco cessation, given that we know that tobacco is the #1 cause of preventable death and disease, both in the US and worldwide. And unfortunately, there's severe disparities. We tend to see that people with lower levels of income and education, people from certain racial, ethnic, minoritized groups, and people with mental health conditions are much more likely to smoke, have a harder time quitting, and are more likely to experience and die from tobacco-related disease. So our work is really focused on tobacco cessation in those populations. As an intervention strategy, we focus on mindfulness, and I'll talk a lot more about mindfulness today, but we're really interested in expanding the reach of mindfulness to more diverse populations that traditionally have not necessarily had access to these types of programs and have also not been included in mindfulness research. And last, I'm excited about mobile health technology as a way to try and increase access to health promotion interventions, as well as to provide just-in-time support when people are out in their day-to-day lives. So what is mindfulness? I always come back to this definition by Jon Kabat-Zinn, which is paying attention in a particular way, and that is on purpose, in the present moment, and non-judgmentally. So at its core, mindfulness is just paying attention. It's slowing down to pay attention to right here, right now. So often we're caught up in thoughts about the past or the future. We're multitasking, we're doing lots of things at once, and it's hard to just slow down and focus on right here, right now. Easier said than done. But that's what mindfulness practice is all about. So I'll invite you to practice mindfulness with me. We'll keep it pretty brief. It'll just be a few minutes. And we'll do some mindful breathing. So if you're open to doing this with me, you can do it wherever you are. You can do it eyes open, eyes closed, it doesn't matter. I often like to start by just taking a little stretch, just huh, release some tension, do whatever you need to do to just settle into the moment. If you like, you can close your eyes. If you'd rather keep your eyes open, that is perfectly fine too. Start by just noticing the fact that you're breathing. Something we often don't pay attention to, we often take for granted. You might take some slow, deep breaths all the way into the belly, maybe imagining the belly filling up like a balloon. Your only goal for the next couple of minutes is just to focus on your breathing, noticing what it feels like as you breathe in and out. And of course, as you do this, sooner or later, usually sooner, your mind will wander to lots of other things. That is totally normal, just means that you're human. So whenever the mind wanders, try not to judge yourself for it. It doesn't mean you're not doing it right. Just notice. Try to take an attitude of curiosity. It can be interesting to see where the mind goes off to. And then gently bring your focus back to the breath. And breathing in and breathing out. Nothing else to do right now. And if your mind wanders 1,000 times and it feels like you're constantly noticing mind wandering, that's totally fine. That's normal. Just notice. Gently bring your focus back to the breath. That's the practice of just coming back, coming back. Taking a couple more breaths at your own pace. Opening the eyes if they were closed. Stretch if that feels good. So thanks for doing that with me. It often amazes me how much just a couple of minutes in the day can make a difference, at least for me. So that was a brief mindful breathing practice. I also really love this practice we call STOP, which is something we really encourage in all of our mindfulness interventions as a way to just stop throughout the day. And it stands for stop, take a breath, observe, just notice what's going on. How does your body feel? What do you hear around you? What do you see? What's going on? Just noticing what's happening in the moment and then proceeding with whatever you're doing. So, mindfulness training is showing a lot of promise. There is more and more research backing up mindfulness-based treatments for addictions, including quitting smoking. And a big reason why we think that mindfulness is really effective in this way is that it helps to teach people how to respond rather than automatically react via substance use or other unhealthy behaviors. So it's all about slowing down to notice and respond more adaptively, purposefully to stress, cravings, difficult emotions, difficult situations, and other kinds of triggers. So there's lots of promise here, but there are also lots of barriers to access and implementation, particularly for underserved populations. And our team has really been thinking about digital health solutions. We know that the vast majority of American adults have a cell phone. And text messaging, I think, is kind of a cool way to provide tailored, in the moment strategies, perhaps when people need it most, when they're out in their daily lives. I love text messaging because it's low cost, it's user friendly. You don't need any kind of fancy smartphone to text. Any regular cell phone, flip phone will text. So we designed a text messaging program to teach mindfulness for managing stress and helping people quit smoking. It's called I Quit Mindfully, and we've designed it over several years now with lots of iterative feedback from real people to get their suggestions to make it better and better. So I'll show you a little bit about what it looks like. It includes reminders to practice mindfulness and other strategies for coping with smoking triggers and urges. We include people's first names in a lot of the text to make it feel a little more personalized. And you can see here a text where we're encouraging that stop exercise I just mentioned. We have personal reminders like, remember, John, you're quitting for your baby Kayla, your health, and to save over $2,000 a year. The texts are designed to be interactive and go back and forth. So we'll ask questions and have people sort of go back and forth to try and keep them a little bit more engaged. We also have pictures that we've developed over the years. And here are just a few examples of what some of those look like. And people can text keywords anytime 24/7 for extra support. So if they're having a craving, they can text crave, even in the middle of the night. Tell me something I can do right now to get through this. Or stress, or slip if they slipped up and smoked, or fact if they want some more information about health effects of smoking and benefits of quitting. We've tried to make the program more interactive over the years. And so we've added things like group polls where we'll ask a question like, what do you look forward to most about being a non-smoker? And then everybody will text back their answer. We'll kind of gather the most popular responses and text it back to the group so that they feel a little bit more connected to other people who are going through it at the same time as them. We have a voice call feature so that at any point people can text a keyword like mind and they'll immediately get a call to their phone with a recorded mindfulness practice that's usually just like 2 or 3 minutes long that they can practice on their own, and they don't need to have internet access to get to that. We've also included quotes from former smokers, and we call them either Mike or Kim, but these are actually real people who quit in our program. And I think people often really like hearing from those people. It can be kind of inspiring to hear from real people who've been through it. And then we allow people the ability to choose sort of the general number of times they want to get texted each day, the general timing, things like that. And they can change it over time so that they can personalize some of those aspects. So far, we've conducted 7 separate studies with predominantly African American adults with low socioeconomic status. And overall, we've had a lot of positive feedback. It's really neat to hear. People really enjoy the mindfulness practices as a way to manage stress and feeling more calm. People will often say sometimes that text came right at the right moment. I was just about to pick up a cigarette and you texted me. And what I find really interesting is that always in these studies, people tell us that they really appreciate the sense of social support. So even though they know this is automated, computerized, I'm not up in the middle of the night texting them, it sort of feels like somebody's out there to help me. It was like my friend or a digital coach or a cheerleader. And so I think that's kind of a neat aspect of text messaging. In terms of outcomes for quitting smoking, we biochemically confirm abstinence with carbon monoxide levels, and we find that in our studies so far, between 20 and 35% are able to successfully quit smoking, which may or may not sound good to you, but we're pleased with it compared to in the general population, only about 7% are able to successfully quit. And then we've started to look at our results by poverty level since we're really interested in socioeconomic disparities. And what we found, this is a preliminary finding, but we found that when we looked at specifically our participants who were living below the federal poverty line, those who received the I Quit Mindfully intervention, about or almost a quarter of them successfully quit smoking. But those living in poverty who received only the in-person treatment without the text messaging support, none of those successfully quit smoking. So there's a lot more work to be done here, but we're wondering if this type of 24/7 support could really make a difference for people who have fewer resources, fewer supports on a day-to-day basis to help them to quit smoking and manage stress. We have lots of ongoing studies. We have a couple of clinical trials that are funded by the National Center or the National Cancer Institute and National Institute on Drug Abuse. If you know anybody who's interested in quitting smoking, please spread the word. We're still recruiting people to be part of our studies and try out the program. And we're excited about a new version of the program we're currently testing out that's called I Quit Mindfully 2.0. It is a smartphone app. I really love text messaging. Like I mentioned, it's low tech, a little bit more accessible potentially, but now most of our participants do have smartphones, and there's just a lot more that you can do with smartphones. So we've partnered with a video production company. We've developed videos and more pictures and lots of different features in the app that we're excited about. Here are some mindfulness resources in case you're interested in practicing mindfulness more on your own. There are lots of apps out there that are great. There are a couple of local centers that are really awesome, both the Mindfulness Center of Atlanta and Atlanta Mindfulness Institute. If you're interested in getting involved in a group or taking a class, they have online offerings. And then there's some websites like this website here through UCLA that have lots of free audio recordings so that you can just go on and follow along. So here's my contact information, both for me and the Quit Smoking Research Study, if anybody's interested in participating. And I'll stop there and look forward to continuing to talk.
Well, thank you. That was a fascinating presentation, and I enjoyed the experiential learning part of it, where we can practice some of the mindfulness with you. So that was great. I'm just curious. You mentioned there a little bit some of the ways that we can get involved, either through referrals or people to your program. Are there any other ways that we can get involved with your work or research?
Yeah, I think for one, just helping us spread the word would be great. I think oftentimes people don't seek out support to help them quit smoking. There's often kind of a mentality that you should be able to quit cold turkey. We have people who have sought support for alcohol use disorders or illicit substance use, and it feels like it's okay to get help for those things, but not for quitting smoking. And so I think spreading that word and letting people know about our studies, and we can let them know about other resources, is really great. And then related to that, our team has really been developing more community relationships, particularly with some local substance use recovery centers, community health clinics, any other kind of community organizations. We're really hoping to be out more in the community. So if anyone knows someone who's interested in quitting smoking, or if they're connected somehow to a community organization that might have relevance, we'd love to connect.
Yeah. Okay. So I'm curious, how did you first become interested in mindfulness research?
Well, it's really personal practice. In my master's program, I worked with a mentor who was studying mindfulness and self-compassion, and I didn't know much about it and wanted to learn more. And so I joined a mindfulness meditation group there, and it was just really powerful for me. It makes a big difference in my life. I've really tried to practice mindfulness on my own since then. And I'll say I kind of go through phases where sometimes I do more formal meditation. And I also find a lot of benefit from just being able to slow down throughout the day. I'll notice sometimes, in my office, I'll realize, you know what, this is a time I just need to take a moment and breathe or stretch, just noticing what's going on right here, right now, and slowing down. It is not rocket science, but it can be powerful. It makes a difference personally.
Yeah. So in your research, do you ever find that participants have challenges or stigmas associated with mindfulness training?
Yes. I think often people sort of have ideas in their mind about what mindfulness or meditation is. We have some people who think that it's a Buddhist practice, maybe it's a religious practice that might not be consistent with their own religion. We have some people who just think it's a little bit woo woo. It's out there. It's not for me. Which I think is all. These are legit concerns. So we've really tried to learn over the years better ways to introduce the concept of mindfulness, and I think people tend to resonate more when we don't even necessarily start out talking about meditation. We'll just use more accessible language, like it's slowing down, it's learning how to focus your attention, awareness, breathing exercises, things like that are a little bit more relatable. And I think using that language makes a big difference. We really emphasize, of course, that we're not teaching a religious practice here, but you can sort of incorporate it in your life and whatever that however that makes sense to you. And we actually have had a number of people say, I'd never really heard of mindfulness before, but I feel like I'm actually already doing it in my day-to-day life, oftentimes through prayer or other spiritual practices. So I think it's awesome when people kind of find a way to integrate it into their own lives.
So do you ever see that the use of technology can create a barrier or an issue for some of your participants?
Yeah, it used to be that smartphones and kind of higher tech devices were more of a barrier, and that's why we started out with text messaging and working with lower income populations, because any regular flip phone will text, which I really like. But that's become much less of a barrier. Now most of our participants have smartphones, and we loan them a phone. If they don't have one, they're welcome to borrow one from the research study. But most of them, even people experiencing homelessness, do tend to have smartphones. Um, we had more issues, particularly in a rural sample. A couple of years ago, we did a study with I Quit Mindfully in different rural areas of Georgia, and we found that the text messaging program went over really well, but people did not have great internet access, or just at least less consistent internet access. And so we really learned kind of sticking with the text messaging and staying away from things that really require internet access was helpful in that population. Um, I think overall, I think a major barrier with technology is in trying to get people to engage with health apps long term. I think people often have the experience where they get excited about some new health app to track their eating or exercise or whatever it is, and they try it out for a couple days, a couple weeks, and then they just kind of forget about it. So I think that's a big challenge with technology right now that we're thinking about, and I think a lot of researchers and tech developers are trying to think about how do we not just create a great app, but something that people want to continue using over time so that it really makes a difference.
Yeah. So do you find that the participants are typically tobacco smokers or vaping or both? And does that have an income or does that have an impact or an outcome in your research?
Yeah, it's been a fascinating time to study tobacco because the products are changing all the time. And we find, at least in our current mindfulness intervention studies, they are focused specifically on people who smoke traditional combustible cigarettes. So everyone smokes combustible cigarettes. I would say our kind of average participant tends to be middle-aged or older. They've been smoking for most of their lives. Most of them don't vape. We do have some who vape. Um, and the jury's really still out in terms of the evidence in whether vaping can change outcomes and help people quit smoking. There certainly could be some benefits in terms of harm reduction if we have somebody who smokes regular cigarettes and is not able to quit and switches completely over to vaping. That might reduce their health risks. But the fact of the matter is, it's a little bit more common for people to continue using both, which definitely has health harms. And vaping in and of itself is not without harms.
Hmm. Um, what do you do for someone who is having trouble or they're not successful initially with the program? And do you give them certain advice or a plan for them to help them through it?
Yeah, I mean, I think most of all, just encourage them to keep trying. I think, unfortunately, quitting smoking is incredibly hard to do. We have a lot of people who, are in substance use recovery, and they'll say, I've been able to quit drinking alcohol, I've been able to quit using illicit substances, but smoking is like that last hard addiction that's holding on. And every try counts. I think CDC had a campaign a while ago that I really liked called Every Try Counts. And I think that's it, really encouraging people to keep trying. Every time you try, you learn more about what works for you and what doesn't work for you, and to try to give themselves a break. I think the mindfulness approach is really all about non-judgment, self-kindness. When you slip up, try to see it as that. It's a slip, it's a bump in the road. It does not mean that you failed. So try to kind of forgive yourself and learn from it and keep going.
Mm. So you mentioned how you use mindfulness. Can you give advice to us or how we can incorporate it into our daily lives?
Yeah, I think starting out, if somebody's kind of interested in starting out with mindfulness, I think trying out some of those apps or online resources can be really helpful. Just so that you have an audio recording to listen to. There are some apps like Headspace or Calm or Insight Timer that you can try out. If you're really interested in getting engaged in more formal practice, taking a class like through one of the mindfulness centers locally, or there are lots of online offerings now. And I think really just purposefully bringing in mindful pauses throughout your day can be really meaningful, for me at least, of those times to slow down, to breathe. And you can do it in the midst of just regular activities. So mindful eating, just slowing down to notice the tastes and the textures and the smells and taking one bite at a time, or slowing down while you're walking or brushing your teeth. Anytime you're really paying attention in the moment, you're practicing mindfulness.
Mm. And that's actually a really good segue to one of the questions that the audience asked. It was asked, can this be used to help treat eating and food disorders or just general stress?
Great question. Yes, there's lots of growing research around mindfulness-based interventions for both for eating disorders as well as weight loss. And there's a lot of growing research there. I think one thing I think is kind of exciting about mindfulness for health behavior change is that these common strategies might be relevant across changing different behaviors, right? It's about slowing down to purposefully respond rather than automatically react, whether it's picking up a cigarette or taking a drink or eating a box of cookies or yelling at someone, things in our daily lives. So I think it's relevant across a lot of behaviors, and eating is a great example.
And one more audience question. Have you ever thought about conducting a national study across multiple universities?
That's a great question. Yeah. First of all, I'll say a lot of our work is collaborative across a lot of different universities. And that's one thing I love about public health is it's team science. And so very often we'll have multiple investigators at Georgia State, but also at other universities. And right now we're doing a fully remote trial of our I Quit Mindfully app. And so it's worked really well, where we've actually been recruiting through social media, Facebook and Instagram across the country to enroll people into our study. And we meet with them over Zoom. We get them set up with the app. And there's just so much that you can do with digital technology when you don't necessarily need to have people come in person. It really expands the reach.
Well, that's great. And so for my final question, maybe this kind of leads to some of that. Where do you see your research in 3 to 5 years?
Well, I'm hoping certainly to continue expanding reach of mindfulness with digital health technologies. I think there's so much new technology to integrate there, particularly across multiple health behavior change. As somebody asked, I think eating is a great example. We already have messages around mindful eating within our program, and so I'm interested in kind of expanding across multiple health behaviors. And then I'd really like to do more around trying to increase the diversity of mindfulness teachers and facilitators. I think that's something that right now is a major barrier because the training programs out there tend to be pretty intensive, pretty expensive, take a lot of travel. And so my collaborators and I have been thinking about ways to train more people from diverse backgrounds to teach and facilitate mindfulness, and even involving peers, I think could really expand the reach.
Yeah. Well, great. We'll have to leave it there, but I do want to thank you all again for attending the Currents of Public Health webinar today. And I want to thank you, Dr. Spears, for participating in such an informative conversation. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, the residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the work of the school and our students, please visit publichealth.gsu.edu. Thank you again to Dr. Spears, and thank you all for attending. Please join us for our next Currents of Public Health webinar on October 12th. Our guest will be Dr. Roby Greenwald, who is an assistant professor in the Department of Population Health Science. We will see you next time. Have a good day.